insomnia, disrupted sleep patterns, and any of those perinatal mood anxiety disorders that I mentioned, that is huge, a huge sign if someone is expressing that they have not been able to sleep for long periods of time, or, they're sleeping for 2 to 3 hours, every day or every night. That is definitely a sign that intervention may be necessary. Some may present with suicidal thoughts, plans, or even intentions. They may not have attempted, so sometimes that is also overlooked, but even if they're expressing those thoughts and they're saying, this is something that I think about on a consistent basis, another sign. Some may have intrusive or repetitive thoughts of harming their child in some way. And again, sometimes it's not necessarily with any intent behind it, but they're experiencing these thoughts. Dysregulated appetite is another sign. So it's not necessarily just an increase in appetite related to pregnancy or even a decrease in appetite because of nausea. It could be that it's just dysregulated, and sometimes they're reporting that, sometimes they have an increase, sometimes there's no appetite at all. Another sign. If they're expressing a loss of interest or pleasure in doing things that they would normally enjoy, or something that has been a normal part of their routine, and all of a sudden they have no interest at all. Another sign that they could be experiencing perinatal symptoms. Ruminating thoughts about their health or their baby's health, feeling very anxious, very worried, excessive anxiety and worry on a consistent basis. There could also be an increase in physical symptoms or somatic complaints. Some complain of, pain in their body, muscle tension, heart palpitations, dizziness, shortness of breath. So these are just a few of the signs and symptoms that are very important to take note of when you're working with or treating perinatal mothers. And Caitlin, in terms of, when to reach out for help, right? So when ASAP, right? As soon as possible, the sooner the better. So as soon as, they recognize, or the people around them or the treatment providers recognize changes in their mood or emotions or their thought patterns, they're just not feeling like themselves, that is the time to reach out for intervention. And especially if those changes are impacting their daily functioning in any way.